Basically, the topic we'll be discussing today is something that might be on top of all of your minds, especially those of you who have suffered from COVID-19 disease. As we all know, over the last 2 years, COVID has wreaked havoc in our lives. It has uprooted our daily schedules. It has uh, caused a complete 360-degree turn in the way in which we work. Online is today the new offline. Uh, Working and attending a physical meeting is now considered to be a thing that is taboo, as is evidenced by the fact that you're listening to me from the other side of your screens rather than in person. But the question that really affects all of us, that really bothers a lot of people, especially those who have been through COVID, is how does COVID affect my heart? Do I really need to be worried as a person if I have suffered from COVID-19 disease? What happens to me if I am already suffering from a heart disease? Does COVID worsen my heart disease? Does COVID-19 put me at increased risk for heart disease? What if I'm a hypertensive? Do I need to stop my medicines? Do I need to change my medicines? Oh, I've seen in the news that certain antihypertensives should not be given in COVID. Is that true? Does that mean I should not take my BP tablets? Is it that I should start myself on prophylactic blood thinners? All these doubts are probably running through your minds, and over the next 30 minutes, I'll try to answer at least a few of them. And for those of you who are live right now, feel free to pass on your comments and your questions so that we can try to answer as many of them as possible. Now, coming to the most basic question of it all, does COVID affect my heart? Unfortunately, the answer is yes, it does. COVID-19 is a disease that is characterized by widespread inflammation. Inflammation in a if I talk about inflammation to a medico, he'll understand it. But if I'm talking to you, somebody who doesn't have a medical background necessarily, what do you mean by inflammation? Inflammation, basically, in layman's terms, could mean swelling. Whenever something is swollen, something is swollen up, it is inflamed. Think of something on fire. That is what inflammation basically is. It's your tissues on fire. All right, so that causes a swelling, a sort of a heat like a fire like reaction in your tissues. That's called inflammation. Now, inflammation very often is the response of our own body when it fights off any organism. Now, the COVID virus per se also causes inflammation and also triggers off an extremely severe inflammatory response in some people who suffer from COVID. Now, unfortunately, it is this inflammation that worsens your heart disease. For those who have already got heart disease, COVID can worsen it and increase its severity. Unfortunately, for those with risk factors of heart disease, COVID can actually precipitate new onset heart disease. New onset heart disease, the most dangerous of them all being heart attacks. I mean, we've seen young patients who have suffered from COVID during their illness having major heart attacks, patients 29, 30, 25, having COVID-19 disease, severe disease, and then landing up with a myocardial infarction or a heart attack. Patients with COVID-19 disease who are recovering from COVID and after their recovery suffering from a heart attack. So this is how COVID-19 basically ends up affecting your heart as far as the infarction is concerned. Now, apart from this, COVID can also have certain other effects on the heart. It can alter the, just a minute. Sorry for the interruption, just give me 2 minutes. I'm really sorry for that. I apologize for the interruption. Now, getting back to where we were. Now, you see, COVID, so that is one thing, it can cause heart attacks. So, if you are a patient who is suffering from or has suffered from COVID and you have sudden onset chest pain, don't ignore it. get an ECG done. I often say this, I've always said this wherever I get a chance to whoever is willing to listen, I say this. Get an ECG when you're in doubt. You have chest pain, you want to be sure it's not heart attack, get an ECG. You have a feeling that it's gas, get an ECG. What's the worst which will happen? You lose 100 rupees, fine. What's the best which can happen? That ECG might diagnose a heart attack, you might reach the hospital early, that might end up saving your life. So if you're a patient who has or had suffered from COVID-19 and you have chest pain which you have never had before, get an ECG. If you have suffered from COVID-19 and you've developed a new onset breathlessness, that means before you were able to walk one or two flights of stairs, now you're suddenly not able to do that. Now, breathlessness is a symptom that is very often associated with COVID, but it's also important to remember that breathlessness is also a very, very important symptom of heart disease. One of the, in fact, in medical terms, when a patient with heart disease has chest pain, it is called angina. You can think of angina as the cry of the heart. In some patients, especially diabetics, they don't have this typical crushing central pain which you hear of in textbooks. Instead, what they have is breathlessness. That means that they are comfortable at rest and walking for a short distance, they feel breathless. Now you might say, how short is short? I mean, I might not get breathless walking till the door, but I might get breathless walking up 3 flights of stairs. So a good way for you to gauge whether your breathlessness is significant or not is think of it this way. If you were able to walk up 2 flights of stairs comfortably before, but now all of a sudden you find it difficult to do that, or you get breathless even after climbing up 1 floor, then that is indicative that something has changed in your body and you need to have your heart looked at. Now, this breathlessness might just be related to the lungs, but it might also be a signal that there is something going wrong with your heart. So very often in the common public, we think, we notice that people think that only chest pain is heart attack. Breathlessness is lungs. But no, it's not the case. Just like pain in your stomach can also be a sign of a heart attack, similarly, feeling breathless is also a sign that you might be having a cardiac disease. Now, other than heart attacks, what are the other things that in which COVID can affect your heart? Now, sometimes you can have very fast heartbeat, or you can have very slow heartbeat, or you can have extra beats, which are called ectopics. So basically, ectopics means something which is present at a place where it should not be present. Like, for example, we are in the middle of a meeting, and some time back you saw somebody walking through. So he was an ectopic. He was here when he had no business being here. So that is how you get extra beats in the heart also. You have an extra beat that lands up in the middle of your heart rhythm when it has no business being there. That is called an ectopic beat. Now, sometimes you might get multiple ectopic beats, which is called as a ventricular tachycardia or an atrial tachycardia. Now, atrial arrhythmias like atrial fibrillation are very, very common in patients with COVID-19, especially those with severe disease. And when atrial fibrillation comes into a patient with COVID-19, it is not a very good sign. That is why if you feel that your heart rate is getting irregular, you need to seek medical attention fast. Everyone should get into the habit of feeling their pulse. Recently we had a very good program on CPR for the common public organized at KIMS. And the one message that we told everyone is that you need to get into the habit of feeling your pulse. Now, 2 finger breaths away from this central heart structure is called your trachea. 2 finger breaths away from that, if you place 2 fingers there, you will find a pulsation like that. That is your pulse. Now, everyone should be able to feel this. Get into the habit of feeling your own pulse, the pulse of your family members, because an absence of a pulse can indicate a catastrophe. It can indicate that the patient needs CPR and needs to be rushed to the hospital. Now, it doesn't need to be as drastic as that. Sometimes you find that normally this pulse goes like tup, 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 like that. Now, instead of that, you get like tup, 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 tup. So it's irregular. That usual musical rhythm of the pulse is lost and it becomes like noise. It gets all irregular. Now, that is called an irregular pulse. Now, that is a sign of atrial fibrillation, and that also indicates that you need to seek medical attention. Now, why is this irregular pulse such a worrisome thing? That is because when the pulse gets irregular, it puts you at an increased risk for a brain stroke, because this irregular pulse promotes clotting inside the heart, which can cause a brain stroke. Now, speaking of clotting, COVID-19 per se has also been associated with widespread clots all through the body. Most importantly are clots in the blood vessels which supply the lungs. That condition is known as a pulmonary embolism. Now, if this pulmonary embolism occurs in the major blood vessel supplying the lungs, it is a massive pulmonary embolism which can be life-threatening. Now, sometimes the clot is not in the major pulmonary blood vessel but in one of the branches. In such a case, the patient will have breathlessness, he may have blood in his cough, he might have breathlessness while lying down, and you might have chest pain also. So patient might have chest pain and then cough with blood in that, and then sudden onset breathlessness. You might think it's a heart attack, but actually you can probably call it a lung attack, because here the clot is in the blood vessel supplying the lungs, not the heart. So that is called a pulmonary embolism. That is another important thing. Now, why am I, being a cardiologist, talking about this so-called lung attack or pulmonary embolism? That is because when this clot forms in the blood vessel supplying the lungs, it leads to an indirect back pressure on the heart, which leads to a dilatation of the right heart and causes right ventricular failure. And if not treated early, it can even be life-threatening. So widespread clotting is the cause of heart attacks, is the cause of lung attacks or pulmonary embolisms also. It can also cause clots in your legs, which is known as a DVT. A DVT can break off from the legs and go to the lungs, again leading to you can have irregular pulse like atrial fibrillation. You can have ventricular ectopic beats, ventricular tachycardias. You can have multiple VPCs or ectopics. Now, most of these ectopics are all self-limiting. They generally tend to subside as the disease subsides. Atrial fibrillation, if it occurs, it's not a very good sign. It needs follow-up. It needs anticoagulation to decrease your risk of stroke. Now, in the early stages of COVID, when COVID was new and everyone was excited about it, there was a lot of data which came in initially, which said that, certain classes of antihypertensives should not be given in COVID because they increase your susceptibility. But it was, as soon as this theory came in, it was debunked as fast as it came in. And we have conclusive data to say that both your ACE inhibitors and ARBs are actually safe, and they have nothing to do with increasing the severity of COVID. So if you're a hypertensive and you're taking a BP medicine, don't stop it, continue it. That being said, under the supervision of your doctor, because patients suffering from COVID have been found to have unusually high BPs. They've also been found to have unusually low BPs. So if you're taking a medicine, don't take a decision to stop it. If you're not taking a medicine, don't take a decision to start it. Be in contact with your doctor, keep checking your blood pressure, your pulse, look for the regularity of your pulse, look for an unduly fast pulse or an unduly slow pulse. Similarly, look for an unusually high BP or an unusually low BP. All right, and whatever it is, you can coordinate with your consulting team. Now, because of the presence of clots, there has been a lot of debate where people say, oh, the COVID can cause clots. So even if you're not having COVID, we never know where we are exposed. So let us take blood thinners. Please don't do things like that, okay? Because remember, self-medication is the biggest, it can cause a lot of problems. It becomes a very big problem for you and for us both, because then you end up inviting trouble when it's not there. For all you know, you might never get exposed if you're taking enough precautions, and you might get through smoothly, but then you end up taking a blood thinner because you're afraid that you might get exposed, and that blood thinner can then lead on to causing, bleeding and GI blood loss. It can cause bleeds in the brain, all kinds of unnecessary complications. So the moral of the story is that, yes, it's good to be aware, and blood thinners do play a role, but there is a time and there is a certain population that requires it, and that population will be given that. So, in conclusion, probably what you need to remember from this take-home message is that COVID is a multi-system disease. It causes widespread inflammation. Heart is one of the organs that is affected due to COVID-19 because of the inflammation that it causes. COVID-19 can precipitate heart attacks. COVID-19 can worsen existing heart disease. COVID-19 can cause increased clotting, which can occur in the lungs and the heart, as well as in any of the vessels in the body. COVID can affect your blood pressure, it can affect your pulse, it can cause unduly fast pulses, slow pulses, high BP, low BP, irregular pulses, increase your risk of stroke. So do not self-medicate. Take your medications on time. And another important thing is regarding the COVID-19 vaccines which are available, whether it is the AstraZeneca vaccine or our own Bharat Biotech's Covaxin or Sputnik or the upcoming Pfizer vaccine. They are all being proven to be safe without doubt. Efficacy-wise, there is a 5 to 10% difference amongst all these vaccines, but safety-wise, all of them have been proven to be safe in decreasing the severity of disease. You might hear people saying that, oh, he took COVID vaccine, still he got COVID. What is the use? All this is business, unnecessary things. Absolutely not. Vaccines have been proven to decrease the severity of COVID. That does not mean that, if you carry an umbrella while going out in the rain, it doesn't mean that you will not get wet. But your chances of getting wet are significantly lesser. And even if you do get wet, you might not end up catching a cold and falling severely ill. So that is something like what a vaccine does. It will prevent you from getting a disease in quite a good number of cases. But some people might still get a disease despite having taken a vaccine, but the severity of disease will be much lesser when compared to those who have not taken a vaccine. Now, for patients with heart disease who are going in for COVID-19 vaccine, you do not need to stop your blood thinners. You do not need to stop aspirin. You do not need to get a CRP test or any other test done beforehand. And you do not need to, stay away from vaccination. A lot of patients, even now, after all these months of and all these awareness programs, who still come and say that they've not been vaccinated because they have heart disease. They say, we have heart disease, we have sugar, we have BP, so we are scared to take. So I tell them, you should not be scared. You should be scared of what will happen to you if after having sugar, BP, and heart disease, you get COVID. Because when COVID affects somebody who's that immunocompromised, it is bound to be a much more severe illness. So if you're a heart patient, do take your vaccine. And if you have not taken it, please go and take it and make sure you take both doses of vaccine. Ever since the data came out that our Covishield has around a good percentage, 60 to 70% efficacy after first dose. Many people have taken one dose and are sitting happily on it. Please don't do that. Take both doses. In fact, it is the second dose that actually seals your immunity and gives you that long-lasting protection. There are people who talk about doing antibodies and then saying, oh, we have COVID antibodies, we will not take vaccine. Please don't do these things. There's no data to support all this. Everything has been well researched, well documented, and it's safe in heart patients. So if you're a heart patient, please do not, stay away from vaccines, especially if you have a coronary stent implanted. Don't stop your blood thinners on your own before going for vaccine. Vaccination is a very small injection. It's a very minuscule injection. It's not going to cause a problem if you take an injection when you're taking a blood thinner. Okay, this unnecessary fear and unnecessary phobia. If you stop your blood thinners abruptly, you can have a heart attack because of stopping the blood thinner, and then you will say that I took the vaccine and I got an attack. It might not be because of the vaccine. It might be because you have stopped your blood thinner before taking your vaccine. So don't do that. And at the same time, don't prophylactically take tablets because you're going. Some people were circulating messages on WhatsApp saying, you take anti-inflammatory, you take steroid, you take anti-allergic before going for vaccination. Please don't do such things. Don't medicate. The vaccination it's a safe thing. Please go and get your vaccination done. Vaccines are the way out of this pandemic. You can see around you. Thankfully now, by the grace of Almighty, we're almost 50 to 60% vaccinated population. At least 50 to 60% have got a single dose, and you can see the difference compared to where we were last year when we had the second wave staring at us. Today, we are still seeing cases, but the severity is definitely much lesser in the population. Now, that does not mean that you stop taking precautions. Please continue to take your precautions. Please continue to wear a mask, maintain hand hygiene, and maintain your social distancing, because apart from vaccination, that is what is really going to help you in the long run. So that is as far as my talk for today is concerned about how COVID affects your heart. If you have any questions, if you've shared anything on the chat box, or you have anything that you'd like to ask me, please feel free to ask, and we can have a discussion as well.